Hello, welcome back to Today in Tech. On today's episode, we're going to be talking about ER diagrams and how they might be applied to the coronavirus in today's day and age. An ER diagram is an entity relationship diagram that shows how, in this case, your risk factors of the coronavirus can be indicative of your overall likelihood of contracting the virus and how one's multiple aspects of one's life might play into that. So if you look at how I started off here at the top, talking about a generic patient, they would have a patient ID as they come in and evaluate their life choices and how these choices might impact their likelihood of contracting the virus. Obviously, we've all heard how age, gender, that plays a big role in your risk of contracting the virus, as well as fitness level and underlying medical conditions that might be on the background that the virus might then feed upon and then have an easier time entering your body, as well as just things specific to the patient. You also have to look at the location of where the subject is living. If they're in a high population density area or a low population density area, obviously that's a big tall teller of how one might be affected by this. If the locals are listening to the rules that are being put forth and the guidelines by their governing bodies, then that is also very important in determining how one might be affected by this virus. The climate, of course, weather plays a big role in how the virus spreads, whether it's warm, cold, hot. That is definitely noteworthy. One's occupation, whether they're a student like myself, working from home, if their company may have been shut down, an in-person company may have been shut down. Now they might be working from home. If they're retired, maybe close contact work. Healthcare providers. Obviously, that's a big change from someone who might be working from home in an office. So it all leads into your exposure. And speaking of exposure, then you look into social behavior, what they might be doing, outside of their time working or studying or whatever they might be currently up to in their life. If they're exercising regularly, if they're eating healthy, if they're wearing a mask as they're supposed to, or if they're going out partying and doing the opposite of these things, eating unhealthy and not getting their exercise in. That's going to be two very different stories as far as how one might be affected by this virus. The local hospitals that the patient would then rely on to seek treatment, obviously uh, carries a big role in not only contraction of the virus but also recovery time. If they can get in and out, if they do contract the virus, if they have a good fundamental guidelines set forth by their hospital where they can then get the treatment they need and be safe. That's a very big factor in then limiting the spread as well. Treatment and testing, obviously specific to location, but testing that's accurate, affordable, and available, and results that come back in a speedy time. That's going to be very helpful in calling out when someone might have a virus versus when it might be unknown. Overall, all these things, all these aspects of one's life lead into the risk and the percent chance that someone might contract this virus, and ultimately, we've all heard of it can lead to death. And I think this is also dependent on the patient themselves. So here I've kind of outlined two different tuples, example of patients here. So you can see I have a 23-year-old male with no underlying medical conditions, a fitness level of a 4, 1 to 5, 5 being the best, 1 being the worst. That's across the board for all these. Sorry, excuse me about that. Sorry, that's across the board for all of these tuples here. So then you can see how location then can also play a difference here. How someone might be from Lagos, Africa, which, despite being the fourth wealthiest city in Africa, it's one of the most poverty-stricken places in the world. So that goes into having this massive population with low living qualities. They might not have the right kind of food or masks being worn enough. It's kind of hard to try and social distance when you're packed in there with a bunch of people. So I really think there's a lot that goes into determining one's risks of contracting the coronavirus, and using an ER diagram like this, and then evaluating using these sample tuples like I just outlined there.